Hey guys, welcome back to the channel. And today we're going to talk about the most common oral lesion in kids. It can happen in adults too, but in kids it's very, very common. So let's begin. I'll show you a quick case, tell you how we manage it and what are the issues and how we do things and all that. So let's start. So this is an 11-year-old. So here's the lesion. You can kind of see it right here. And the complaint was it gets larger and smaller and larger and smaller, and it's slowly growing in size. And these are actually very, very common lesions. They're called mucoceles. I'll show you how we manage these. So you can't just simply, this won't go away, and I'll explain to you why in a second here. So we all have these little salivary glands right here. And these salivary glands, they're minor mucus glands, and they secrete mucus into the mouth, and there's a little duct that you can see right there. Now sometimes, and this happens a lot in kids, the kids almost always, they bite the lower lip, they cause trauma to the lower lip, so the duct gets cut, as you can see right there. The duct gets cut, and what happens is you got this mucus that starts to secrete under the mucosa or under the skin inside the mouth. And it starts to secrete, and the problem with this is the mucus is pretty irritating to the tissue, so the tissue starts to form this little fibrous capsule, so it starts to form scar tissue around this thing. Okay, and I'll show you guys, and here's the scar tissue, it's like right there. So what we need to do, really, we can't just leave this in there because it's going to keep getting larger and smaller, and it's going to keep secreting this mucus under this mucosa, and it pops and it goes away, then it keeps coming back. So what we need to do is two things. We need to obviously remove this fibrous capsule, and also what we need to do is remove these glands, because otherwise they'll continue on happening again. Typically this is done under a little bit of nitrous. We numb the area. In this area, we do a little bit of local anesthesia, and in this area. And one thing, as you can see here, this procedure can be very bloody just because the lip is extremely vascular. If you ever popped, knocked something out and caused some trauma to the lip, you really know. I mean, these things bleed a lot just because there's a lot of blood vessels here. And so what we do is, we make a small incisions through the mucosa, and then we slowly, you can kind of start seeing the mucocele or the little fibrous capsule under the skin. And what we do is we dissect around it slowly, around here, just all around it, 360 degrees. We dissect around it. And a lot of times when you're dissecting these, it pops. And all this mucus comes out, and now you're just left with the scar tissue. But it's important to remove the scar tissue and the little glands, and I'll show you guys how we did that on this case. And again, this is us dissecting around it, and you can see it's basically a mucus-filled capsule. If you pay close attention, you can see the salivary gland right there. That's the little minor salivary gland. It's right there, and it's important that we get these out as well. So very, very important that we do this. And we dissect some more, we pick it up. And again, this is not a true cyst. This is just a bunch of scar tissue, because the mucus that the gland secretes is actually pretty irritating to the body, and almost always your body forms a little scar tissue around it. And it looks like a grain of rice. Here's the little gland, the mucus gland right there. And this is, again, another view. We're slowly dissecting underneath it. So we remove it, but here's a gland right there. And this thing actually came out with two little glands right there. So we take those out, and these have no sequelae. I mean, you can just remove as many as you want. Nothing's going to happen to the lip, or your lips won't run dry. We just have a lot of them. We have a ton of them, and they're everywhere in the mouth. And here's the mucocele. Again, we got lucky on this one. Almost always these things pop, and all this mucus comes out. And I want to show you, here's a little gland. You definitely have to take out, if there's any other glands in the neighboring area. And here's another one here. There's one right there. I hope you guys can appreciate that. And we just send this off to the oral pathologist, because sometimes there are different types of oral tumors that can cause this. So we got to make sure that, this is not something dangerous or something we need to worry about. in the long term. And we put these stitches in there. These are dissolvable stitches, and the job of the stitches really is to stop the bleeding and kind of put the wound together. But sometimes with kids, the lip moves around all the time. They do come out and people have an ulcer, but it heals with no issues there. And so we send these off to the pathologist, and this is what we get back from the pathology. And as you can see here, it says, this lesion is consistent with mucocele, and this is kind of what we get back. As long as it's nothing dangerous, there's nothing to worry about. We don't have to follow these up or anything. However, I just want to tell you that the most common problem with these is because you're cutting through the tissue. Sometimes you can create new mucoceles by doing this. However, I want to say that's pretty rare. One last thing I do want to mention before we finish is a lot of patients do ask that I want to do this using a laser. Now, what a laser is, it's a very high intensity light that burns off the tissue. So, you make the cuts, and what happens is the tissue gets burned here, all along here. And people feel like, oh, this is new technology and it's less invasive. But in reality, all you end up happening is you end up killing all the cells in this area, in this area, in this area. It's basically high heat. So what happens here when you suture everything up, now you have pretty much burnt tissue inside your wound in between the two areas here. And this actually heals a lot slower than if you were to cut the tissue with a blade. So I typically like to use, we have a laser here, but I don't use this for this purpose. I usually like to use just a traditional steel blade to do this, and people actually heal much faster. So just so my personal opinion on this, lasers are, yes, they're new technology and they are cool, but all they end up doing is burning the tissue. So I hope you guys learned something. That's how we manage these lesions. These are the most common lesions in the mouth. So I just want you guys to be aware of and how we treat them and how we manage them. Thank you.